So thank you everybody for joining us this morning. As I said, my name's Vic and I work for the Brighton Hove Food Partnership. We have put this session on today because every year we do a survey of our emergency food network. And my colleague Emma will tell you more about that in a little bit. And we thought that it was a good opportunity just to kind of bring people together, have a look at what we found, have a chance for some conversations around this. Because there's some people here that are not from Brighton, I thought I'd do a very quick introduction to us as a place as well, because I think Brighton's one of those places that lots of people think they know, lots of people visitors. We have millions of people who come down for the weekend and they see the Green Centre with its sustainable shops and its lively beach, and that is part of us. But also it's a city of vast contrasts. We have 13 of the most deprived neighbourhoods in the UK, which is from the latest IMD data. Our health counts data shows really high levels of anxiety, mental ill health, lots of issues around housing. We've got really, really expensive housing. So this is a kind of real sort of pinch point for the city. But we also have a really long history of community action. And in many ways, we're a place that welcomes lots and lots of different communities. So the kind of the differences in our city is something that is actually often quite startling for people who don't know us so well. The Brighton Hove Food Partnership, we are one of the old ladies of the Food Partnership Network. We've been around for over 20 years as a food partnership. And I think it's fair to say that, you know, I've been there for quite a lot of that. Over the last years, the issues of food insecurity and food access and these sort of health and well-being implications of that have become a much bigger part of the agenda on which we were working in. We will be looking at some of the history around sort of food banks in the city. But, you know, when we first started our emergency food network, we were horrified because there were 10 food banks in the city. And now we are seeing many, many more people. So as I say, today's a chance for us to have a look at the findings. My colleague Emma, who is the person who sends out the survey, analyses the survey, pulls together the case studies for the report, is going to do a presentation on our initial stats. We'll then give anyone a chance just to drop any questions if there's anything factual or that's not entirely clear from that. And then we'll delve into 3 case studies, one of which Emma's going to speak to because they can't be here today. And then the other 2, which is Ruben and Amanda, who will be speaking about their own projects. And there'll be a chance for questions after that. So thank you. And over to you, Emma.
Great. Thank you, Vic. I'm going to get my presentation booted up. It's great to see so many of you here today and super exciting to share these findings with you. I've been working on this report and the survey for the last 3 years, but as Vic said, it got started in 2013. So we've got a long history of collecting information about food banks across the city in different ways. But yeah, great to talk about this year's findings with you. So first of all, what is the Emergency Food Network? It's a good place to start. The EFN is a collaborative group of independent food projects. So while we as the Food Partnership aren't delivering food support directly right now, there's food projects across the city which are part of our network, grassroots, independent, working together, and we take a facilitating role in that network, really being driven by the need of the members. So we're very responsive to that. And yeah, when we started the survey back in 2013, there were less than 10 food banks in the city. And now we have more than 50 food projects operating out of over 60 locations in the city, which is quite staggering. Just, yeah, showing the response that people are having to the need in their communities. A small number are Trussell affiliated, which you might know about. They're a national network, so they're operating in lots of different areas. But as I said, the majority are grassroots and yeah, really emerging in response to needs in their individual communities. You can see on the map here a spread of the different types across the different areas that we take into account in this survey. And who is in the network? You can see a list down the side here of the different types of food support that people can reach out for and be referred to. And food support is offered, yeah, kind of based on the diverse needs of these diverse communities. It's also very dynamic. So there's new food projects emerging all the time or transitioning how they're working. You might have seen news that in our city, we've got a Trussell affiliated food bank, which has recently been the first to close its doors due to success. It's now moving to transition to become like an advice service. We also have food banks that are transitioning to more of a membership model. So an affordable food project model that has a membership fee that allows members a bit more choice. It's just a different way of doing things. And we also have, at the same time, examples of affordable food projects or social supermarkets, which are realizing there's a need for a free service for their users as well. We've got a pilot project at the moment where an affordable food project is setting up a satellite food bank for their needers, food service needers who are in need of a free service. And yeah, later you'll hear from Ruben and Amanda, some coordinators from projects where one's been going for 5 years and another has just opened this year. So that'll be interesting perspective to see. And yeah, also to say that many food projects and community centres are offering a combination of these services all under one roof. So it's can be a very varied offering, and it's all about cohesion and collaboration between the projects and the network. So we love to see the quote like the one I've put here under the picture. We consistently get told that it's really helpful for people working in this what can be really challenging area of work to feel less alone in what they're doing. So yeah, me and Joe work for the Food Partnership to facilitate this network at the moment with help from our team. And it, like I said, it's led by the needs of the members. This is a list of a few of the things that we get up to. There's really active comms channels around surplus food sharing and sharing resources and sort of peer support. We run regular meetings, themed workshops. We recently ran a celebration event to thank everyone for the work they do, which was wonderful. And we also, a key thing is our ability as the Food Partnership to liaise with, I guess, sort of change makers and contacts in the council, for example, to get the messages across from the food banks and food projects across the city into those other layers of decision making. That was really important during the pandemic. The network was really key in mobilizing a quick response to food needs then, and we'd be ready to do that again if needed. And yeah, you're all here today to hear about the annual survey. So let's get into those results now. So we found from the survey is sent out to food projects and they report back to us what they're finding in their communities, and then we collate that. So they've told us that in 1 week in July, at least 5,800 people were supported by their projects. That's a high number of 800 pensioners and at least 1,500 children included in that number. And what I want to emphasize here is that our survey only takes into account those who come forward to seek food support from their projects, just by the nature of the way that we ask the question to the food projects themselves rather than surveying the public. There are national organisations who survey the public, like, for example, a recent report by Trussell that's found that over half of people experiencing food insecurity don't seek food support and instead go without the essentials. There's multiple reasons for that. It could be the stigma around seeking food support. It could be lack of information. There's lots of things that come into that. But just to emphasize here that the true scale of food insecurity in Brighton and Hove is likely to be much bigger than this number suggests. And it could, in fact, be the tip of a much larger iceberg. So considering food insecurity in general, it's important to remember. So in terms of how these projects are running, a large cost is being spent to provide that food to people. So this number here, £13,600, is excluding things like fair share subscriptions that projects might have. This is a lot of this number will be projects topping up on food from the supermarkets. So yeah, over the year, that's a lot of money that projects are needing to fundraise and find from somewhere to stock up on food to feed people. Either, yeah, just the quantity that they need, but it might also be what does their community need? Does their community need a particular type of food that isn't being donated from the public? So yeah, that's what that number is indicating there. And yeah, staggering, we've got 653 volunteers giving over 2,000 hours a week to support food projects. That's incredible. We've also got a paid team of paid staff that are, independently in these different projects. You might have a staff paid member, but the vast majority of people working in this, if we can call it a sector, is they're unpaid. And what we found this year as well is that a third of the lead contacts, these food project coordinators, founders, are volunteers themselves. So, and whether, there's sort of a conscious effort to delegate and have volunteer team dynamics there, I would say that it can be the case that these leaders will take on the kind of shouldering a lot of the stress of what can be this very difficult work for their teams. So thinking about volunteer well-being and team well-being in response to this work is something we're really, really keen to analyze more as well. So this is the nitty-gritty of the types of food support that people can receive. Food parcels is what you traditionally find at a food bank. You're being given a bag of food, for example, and we're finding that number overall has dropped since 2024, is an indication that there's a transition to other types of food support. So it might be that people are receiving a food voucher, which is a kind of cash first approach to food support. People can go and spend that in the way they want to at the supermarket, or an affordable food shop. Maybe you're paying a membership fee and then you're able to choose from a selection of food laid out in a sort of social market, supermarket style model. We've also got a lot of people eating at the community cafes and meal projects that we've got across Brighton. They're also great hubs for sort of community and coming together over food. And we have a Meals on Wheels project, which operates across the city, East Brighton Food Co-op, and other food banks which deliver meals as well. So a lot of these meals are being eaten at home. And it's not just food. There's often people present at a food project because the food is the bit they need to get solved urgently, but that there are lots of underlying causes that resulted in somebody coming and being at a food bank on that day. So that's something that people running food projects are super aware of. And there's, I'd say, the majority of them now are offering advice services, or what we would call wraparound support services alongside the food. This is a quote about from a food bank coordinator from the survey, just talking about just food is not enough. Giving the food is not enough to support people to change the situation they're in so that they're not relying on food services. This is a slide about the types of wraparound support that food projects are giving, and just saying as well that under new funding from the council here, the Food Partnership is going to be working with the Affordable Food Network around advice. So that's incorporated into the city's Advice and Financial Inclusion Partnership. So more to come on that. I guess this is important about demand and how does this compare? You can see it's it's remaining stubbornly high, and we could say, oh, there's a drop, but actually compared to 2019, it's incredibly high, and it's indicating a bit of a normalization of food insecurity since the struggles of the pandemic. This problem isn't going away. And we also see that there's some projects that are just reaching their capacity. They might be full and unable to take new people. They're always innovating to try and do that. But that's something maybe worth thinking about. So this is like the main reasons we ask the food projects, why do you think people are needing your service? Or are you seeing more people from particular demographics coming in than before? It might not be a surprise to anyone. It's the main thing is the increase in the cost of living, household income not covering essentials. But yeah, debt, benefits, disability and health related issues as well. So that's where the advice and wraparound comes in. If you can help people with their debt or help them get the benefits that they're entitled to, that'll often then have a knock-on effect on their food budget. And yeah, accessing a space for socializing is also something in these projects that have a front door where people can congregate. Noticing also, yeah, increasing clients with mental health issues, reports on how as people remain in a state of crisis over a long time, that exacerbates mental health issues, or new mental health issues can emerge for people. Yeah, there's a few other demographics here that food projects are noticing. But I guess what's interesting to say is that it might be there's an increased need in these groups, but like we were saying earlier about the tip of the iceberg thing, there might be people out there who really are in need of the support, who are just having the confidence or having the information to access that support now. So seeing people from minoritized groups accessing this food support for the first time might actually be a positive, that they're finally getting the support they need. So just a few more slides. This was a question around, does your food project have sufficient funding for the rest of the year? And in 2024, this was over 50% were saying no, which, that's indicating a kind of the anxiety that projects can have about, are we going to be able to keep our doors open? Are we going to be able to keep offering the service at the level that we are and support the same number of people? This year, we had the announcement that Household Support Fund, which was supporting these projects in our city, was extended for a year. So you can see here that's had a knock-on effect, that we've got resounding more yeses than the last time. Yeah, we now have the Crisis and Resilience Fund, which has been announced to replace Household Support Fund, which really great to hear that's going to be a multi-year fund. But yeah, how that's going to be allocated is going to be key for these projects, knowing how resilient they can be into the future. So yeah, one of the things we do with this report is take the campaign asks from food projects and what are they asking us to do. I'd suggest looking at the report itself for the full list of the campaign asks and what we're going to be working on as the food partnership and within our networks. But this is the key sort of top lines here: funding and policies that enable preventative work. That might be around wages that are reflective of the cost of living, or benefits that allow people to be able to pay for their essentials. Support from the community networks and local food partnerships. So there's lots that can be done around businesses and the food partnerships themselves, keeping these networks running. We can see it's really beneficial, and reliable and affordable sources of food for food projects. We have a surplus food network that's integrated into this as well. We have a surplus food WhatsApp chat, like I said. But yeah, is there anything supermarkets can do to help food projects access affordable food? Is there, can we do community sourcing of food in a more efficient way? That's something that we're working on as well. And just to end on this part, on a quote about why we need this action now, I think that number, 5,800 people a week in our city, we shouldn't be getting used to that. That shouldn't be the normal. And this is a quote from someone working in a community centre food project about that we shouldn't be getting numb to this or accepting this. We need to be fixing this, not just the symptoms, but the cause as well.
Thank you very much, Emma. That was really useful look through all of the initial information. There's a question in the chat from Amy, which is about how that 1 week in July is selected. Just to say, what your question goes on to say, in case people can't see it, is it representative of an average week? Is it a particularly high week? Actually, it's the total opposite. When we first started doing the survey, we picked a week in July because we knew there was the lower risk of over-reporting, because it is the quietest time of year for food projects, as many of you who work in them will know. When winter you have to pay for your fuel as well, it becomes much higher use. Plus, because of that, it means that for the food projects, it's a little bit quieter time of year. Not that it's ever a truly quiet time of year, but it also feels more reasonable for us to ask them to spend time filling in the survey. Because we've always done it as a week in July, it gives us continuity over time of what we're looking at. So although it's not like, the exact number, we can certainly look at patterns, which is really useful. So actually, that sort of the answer to that question is it's the opposite to the particularly high week. And really happy to kind of, if you want to look back at some of the earlier ones, they're actually, all the previous reports are also on our website. Before we move on to looking at the case studies, does anybody have any other particular questions on those stats that they want to ask about? I can see somebody's typing, so I might just see if that comes out as anything. I guess one of the things, I've been kind of involved in this over a number of years, and I think I just also wanted to say a big thank you to all the people who take time to answer it, because we know it's another thing to do on top of everything, and actually but it is really, really useful for us, both in terms of local campaigning and national campaigning. In terms of the why models are transitioning, I think it's a bit of a combination of both a strategic decision across the city to say we want to look at this sort of beyond the food bank model, where we're looking at how food projects are places of change. They're a great way for people to be able to access support in their community, but we want them to be about a more wraparound options of support. So be that you can actually talk to somebody about fuel poverty and how you can insulate your home better, you can access mental health, you can access advice. And so in order to create those spaces, it's looking at having less of a short-term food bank model and more of a long-term wraparound. But it's like nobody is forced to do it. It's like at the end of the day, what we love most about our network is its diversity, is its difference, is the fact that people know what works best for the people they work with, and we welcome everybody to come into the network to be able to bring that perspective. So on that note, I'm going to hand over to Emma to just very quickly introduce, because there were 3 case studies within the Emergency Food Network report this year, and sadly White Hart can't be with us, but we wanted to give them a little bit of profile. So Emma's going to talk on behalf of them, and then I'm handing over to Ruben next from the Village Food Bank, and then to Amanda from Pankhurst. Is that the right way round? Look at me, I've got notes and everything. Over to you, Emma.
Great, thank you, Vic. Yeah, so this is based on the interview which the White Hawk Food Bank gave with us this summer during the survey. And this food project just celebrated their 10-year anniversary, which is incredible. They're part of the Trussell network. And Trussell as a whole are aiming for a UK without the need for food banks. They want to stop existing. So that's a key part of what their work is. And being placed in White Hawk, it's one of the neighbourhoods that is on that level of, it's one of the 7% most deprived in the indices of deprivation in the country, but with an amazing community spirit. And recently been announced very recently that the government is going to grant a Pride in Place fund for White Hawk, which will bring £20 million to White Hawk over the next 10 years. So that's going to be incredible to see what they're able to do with that. So what they found at White Hawk, again, was that a lot of people, it's not just food, they need the advice enabled to tackle the areas in their life where they need that extra support. So they have, when you enter the food project, there's a free cafe, there's vegetables and fresh bread that you can take however you want. There's an open space, it's in a church hall, an open space with tables which are laid out for people to relax while they wait for their food to be prepared for them. And at the same time, there will be the advice cafe. So they'll be visiting, or it's normally visiting advice workers who people can go to for support on the day. it's not always the first time that people go. It might be the fourth or fifth time they go when they feel confident enough to reach out to that person from the Citizens Advice Bureau, or there might be a debt advisor. They've sometimes have support from for pets and people's companion animals. There's a wide range of support they offer, but they're really putting an emphasis on that as their advice cafe sort of takes off as more of a thing in the food bank. And yeah, feeding into their national campaigns. We've been supporting them on the Guarantee Our Essentials campaign. There was a lobby day where we went up to Westminster to meet our local MPs to talk about these issues with them. And it was wonderful for the team at Whitehawk to be able to take some of their clients there as well to meet the MPs. This is a quote from Daisy, who's the neighbourhood engagement coordinator, just around how, including clients and volunteers in these events and meeting MPs and decision-making processes just makes all the difference. And it's something that a lot of these food projects are doing. And I think, Ruben and Amanda will touch on that as well in terms of volunteers and clients and that crossover in their projects. They can speak more on this. Obviously, there's their website, so do follow them up if you're interested.
Thank you. And as I say, all of these case studies are written up in full in the report. So I'm next going to hand over to Ruben from the Village Food Bank. And as we were kind of waiting for everybody to join this webinar, I was reminding him that we first met when he popped into our office to tell us that he'd got an idea for opening a food bank. So it is brilliant to be able to introduce him here today, to be able to say more about what's been happening with the Village Food Bank. Thank you, Ruben.
Hi, everybody. My name's Ruben. My pronouns are he, him. I'm the founder of the Village Food Bank, which is a food bank specifically for Brighton and Hove, but LGBTQ plus people that live in the Brighton and Hove area. So we've been operating it's just been a year. So it was November 2024 that we started. And there was some sort of pre-launch work that was done for a few months before that. So like Vic is saying, it's really lovely to kind of this webinar is a good opportunity for me personally to reflect on everything that we've achieved and everything that's happened over the last year. So we have about 170 households registered to use our food bank. Thankfully, they don't all come at the same time. We serve between 30 and 40 households at every session, which we run 2 a month. So you might be wondering why, what's the benefit of an LGBTQ plus specific food service? Like, why can't they just go to the existing food services? And there's a bit of a story to that. So for the last 3 years, I've been a social prescriber, specifically working in the LGBTQ plus community. So with trans and non-binary people as one group, and then LGBTQ plus refugees as another group. And I was getting quite concerning feedback from some of them about the way, about microaggressions and their sense of mistrust in other foods, as in being worried that they're going to be experience discrimination or exclusion in those other spaces. As a queer Christian, I don't have, it's obviously not an issue across the board in terms of church provision. The food sector wouldn't be where it is without the incredible work of all of the churches and the faith communities that are part of this network. So shout out to all of you for your amazing work. But there is a real sort of fear and concern amongst LGBTQ plus people that they're not going to be welcome, or that they're going to be judged or sort of excluded in faith-based spaces. So like I say, I'm a Christian. I'm not saying that's necessarily always the case, but it certainly is an issue. And there is a couple of sort of large food banks in the area that are run by churches have expressed quite concerning anti-LGBTQ plus views. So that's kind of where it all came from. Was I was doing the work as a social prescriber. I already knew that statistically, LGBTQ plus people are more likely to need a food bank, and that's because of issues around mental health and underemployment, discrimination in the workplace, um, underachieving in terms of education because of bullying and other concerns like that. But then we also face additional barriers in accessing food services. So it became quite clear to me that this was a gap in our local food sector that should be addressed. And then that's kind of where it all came from. So really happy to be here and happy to answer any questions as well. But I guess quickly, some of the things I could say is that we are a food bank, so people don't pay for their membership with us, but it is a social or like a community supermarket based model. So people still go around to their different sections and choose the items they want to take, with sort of clear limitations on the different types of items and how many people can take per section. We also have like our community table where people can have obviously free hot drinks and snacks and do activities. And that's a very well taken up aspect of our project, which is really lovely. We always have kind of like chill music playing. Everybody gets a really friendly welcome. And when people arrive, if they're new, so either their first time or they're a bit unsure, or maybe they have a physical disability or they're autistic, so that being in the space is challenging. We have a role called a personal shopper, and that's basically when there's one or two volunteers that are assigned to be personal shoppers so that they are available to those people that are new or might need a bit of additional support, and they can go around the sections with that person, and then when the shop is finished they can sort of keep an eye out on them, checking that they're doing okay over at the community table. We don't offer advice ourselves, but we do bring in external professionals from those specialist services to provide on the spot information or kind of just relationship building with our users. And that's also taken up very well because we understand that accessing services, when you've got a lot on, basically, which is all of our users, it can be hard to do that. So as much of a one-stop shop model as we can possibly make it, the better. And that's not always just around kind of finances, although we do have people that give benefits advice. We also have people we have a sexual health worker that comes in and does testing and sexual health information and gives out condoms and all kinds of like fun stuff. So it's really a diverse space. And if any of you ever want to come and visit, you're very welcome. So do let me know. But I've talked a lot, so hopefully that I haven't gone over time too much. But
Ruben,
thank you very much.
Thank you so much. And before I introduce Amanda, one thing I'm actually going to say is that one of the things that's great about our network as well is the way that people are willing to share what helps make services better and more accessible. And I'm particularly going to say, thank you to Ruben for being willing to do this with the network, but also that whole inspiration and tips around actually, the personal shopper idea is something that other places, it's really inspiring when we hear from each other. So I'm now going to hand over to Amanda and then I'll take a chance for any questions off people. Over to you, Amanda, to tell us the story about Pankhurst Pantry.
Yes, hi, thank you. And I said Bore da as well for our Welsh colleague. It's very exciting. So I'm Amanda. I'm the co-founder and I'm the manager, but as a volunteer of the Pankhurst Pantry. And as people have said, we're a social supermarket. We do work on the donation model with people coming into us. And we serve an estate in Brighton, which is, for those who know, near the racecourse and the General Hospital. And it's one of those areas that is a small pocket of deprivation amongst quite affluent areas. So people would not assume necessarily that there was a need there, but there very much is. We've been going for 5 years as the Pankhurst Pantry. And I know Emma wants me to say this. When we started, I didn't think we'd still be needed and we'd still be doing this 5 years later. We thought we would transition from the pandemic food bank that we were. We were one of those food banks that popped up during the pandemic to serve the local community. Loads of us got involved, and some of us then spun out into this project and are still going. We decided 5 years ago to move over to the social supermarket model, partly to reduce the stigma, because we found that people didn't want to come. And when we were delivering bags of food, they were very happy to receive the help. When we said, can you now come and collect your food from us? They didn't want to be seen coming. So we were like, what can we do to reduce that stigma? And we also found that people were returning food to us, because although we tried to tailor our bags that we made up to their needs and their likes and their food allergies, it didn't really work. Some people just don't like baked beans or tinned peaches or rice. So we decided we let people choose. We give them back some dignity, we give them choice, and we'd reduce the stigma. And I think in terms of successes, I think that's really worked. It's very much a community project, very much a social space. And I know Ruben's talked about barriers, and I know there are. Once people have made that step to come and see us, if they can get over that, I believe that, they find us a welcoming place. And we know that because people just keep coming back to us. We carry on because there's the need. The need is still there, and the need is increasing. We started with 20 to 30 households 5 years ago, and we're now regularly seeing 60 or more every week. And I'll talk about that in a minute, about that. That's one of our challenges. But we carry on because of the need, but we also carry on because we enjoy it. I've got a brilliant team of volunteers. We have a turnover of volunteers, and we're always looking for new volunteers and bringing them into the system. But we have a really good team, so I can rely on my team. I have taken days off, and I can take a day off and know that the thing will still work, and they'll carry on without me. So that's a brilliant thing to do. Successfully, we're financially sustainable. This year we've been able to get frozen food from Fair Share. So we've got the locally sourced venison, which has been very popular, really good, and a cheap and nutritious source of protein for people. And one of the things I like most about the project is we've seen people over the years come to us, some from referrals. You don't need a referral, but some people are referred to us for a free shop, which we'll provide. And we've seen people go from the referral from housing support, where they've been homeless, moved into housing. They then became a regular with us, then a volunteer with us, then went into training, and then have gone into employment. And now they don't need us anymore. And this person, literally became friends with some of our other volunteers and found social and psychological support through that friendship. And they would come in and chat about football with the other guys. It was really lovely, and moved on. That one sticks in my mind, but we've got loads of examples like that where people, we talked about the other day, didn't we, Ruben? I call it crossing the table. Our customers will become volunteers. Volunteers are also customers. So we try to break down that divide and build the community. And I see people also supporting each other. They'll chat in the queue, or they'll ask questions, and we know our regulars, and we'll say, oh, I don't know about that, but so and so does. So there's lots of sharing and exchanging of things. But we also have all the usual challenges that those who are running projects will know, all the business as usual challenges. The biggest one is food supply, which Emma touched on. The logistics are difficult for us because most of us don't drive or don't have a car. So we sometimes miss out on accessing some of the other sources of food supply that other projects can. And all of our volunteers at our project are in work. So we're doing this on our days off. So we don't have time to run around the city on the other days of the week collecting food. We're coping with the increasing numbers, but topping over 60 is very challenging for the amount of food we get from Fair Share and the amount that I'm able to buy in to top up. It is challenging now, but I said that when we hit 50 last year, and I said I thought we might not cope. So we'll find a way.
Amanda, I'm just going to introduce you quickly because there's a question about what your membership cost is for clients. Do you want to talk about that while you're there?
We have a suggested donation of £5. but we don't insist on a donation at all. And we very much encourage people to be open with us. We try and make it as low key as possible, so people won't know that you're getting a free shop. Just myself and the person who does the checkout will know. And we try and make it, there's no stigma to that people can just say, I'm having a really bad month, and we'll go, yeah, it's fine, don't worry about it. But our average donation is £3.50. So if we average it out, most people are giving us, and some people, the people who work at the General Hospital, come over in their lunch hour and will get some fresh bread and a tin of soup and a few bits of fresh veg and bung us a tenner, because they use us, they refer their clients to us. And so it all balances. But £5 we've stuck out for a long time as a suggested donation, and we don't charge a membership cost. I just want to touch on one of our biggest challenges, and we've had a couple of things recently which have prompted me to reflect on our procedures, is keeping healthy boundaries. We don't offer as much advice and support as others. We have people dropping in from CAB, we've had the fire service. We try and signpost and support people as much as possible. But some of our clients, customers, sometimes ask us to do things and like, well, will you come round and do this for me? And yeah, we do have to be aware when to say no, and I have to make sure that the other volunteers know where to keep a healthy boundary with people. And I think you asked Emma about what next. I'm always thinking about what next. So we would like to get chilled food from FareShare, so I'm hoping we'll be able to do that soon. We are financially sustainable, and we got a little bit of extra funding we weren't expecting. So we are supporting community events. So we've had a summer fair, we're doing a winter event, we've had a Halloween event, we've done a quiz. So we want to do that again, probably like a give and take day. Sometimes we have a table of clothes and things that people bring in. We do a give and take, so we want to expand that. And I also want to survey our regulars, and I want to ask them, because every time, like last Christmas, I asked them, what do you need? What things should I buy in for Christmas? So that's, they told me that's what we did. But I really want to do a survey. We haven't done one for about 3 years, to really dig into some issues and find out what we should be doing next. And then, yeah, we just carry on. That's it, really. One day they won't need us, and that'll be brilliant.
Thank you so much, Amanda. Thank you, Ruben. We've actually had a couple of questions coming in on the chat, which I will put to both of you. One of them is about basically, how do you keep financially sustainable? I will smile at the fact that projects that think they've got funding, that projects that are excited they've got funding for 6 months, see themselves as financially sustainable, because to me, this is just an indication of how hand to mouth it has been over the last few years, that 6 months suddenly feels like a lot of time. The other question is the sources of food outside individual projects, for example, corporate support. Before I go to Ruben and Amanda, one of the things just to say is, as Emma alluded to, we do have something called the Surplus Food Network, which is a selection of organisations that are involved in the collection and redistribution of surplus, which we set up a few years ago to kind of help them coordinate. So there's a gleaning network that goes to farms, there's FareShare, there's the Real Junk Food Project that goes to supermarkets, there's a lot of ad hoc, like the independent local bakeries and volunteers driving them around. And what we're trying to do was actually help those involved in surplus food be a bit more coordinated, so that they were, we were making the most of it. I would say that certainly in the last year, we have seen a huge drop in the amount of surplus food that is available, particularly stuff that's available at supermarket level. And when you ask the supermarkets, they tell you it's because the AI has got so clever. Their ordering systems are so much better, right? Which means that the stuff that we're getting is often in bigger packs, which isn't suitable for households. So there's a lot more repacking going on. That's just a sort of more citywide kind of oversight. But maybe I'll go to you, Ruben. First of all, how financially sustainable do you feel? Where do you get your food from?
Well, Amanda made a really good point when we were chatting yesterday about how supermarkets have been able to monetize their surplus stuff. So I thought that was really interesting and true, and I'll let Amanda speak on that a bit more after. So, are we sustained financially? The answer is not hugely. But we have a really, really good arrangement with our venue, which is the Bright Helm Centre, that they actually charge us half price for the room hire. And then our storeroom is the kind of this big corner cupboard in the corner of the space that we hire. And they charge us a really nominal amount of money per month to have that storeroom. So our relationship with the Bright Helm has made our project much more sustainable, which is really good. But it is very much kind of forecasting over a period of like 2 or 3 months whether we're going to be able to run all of the sessions that we've got dates for. So we've launched, or like not launched, but made public all of our dates for 2026. So that they better all happen, and we only run twice a month, so we don't have capacity or funding to run more often than that. So there's I guess a few things that we consider in terms of how we make ourselves sustainable. We also have good relationships. I guess like that's a helpful thing about so although we don't operate in like a specific location or neighborhood, but we operate within a community, that the community is quite good at kind of stepping up and supporting grassroots organizations. And we've had a lot of support from the LGBTQ plus community that see the need for the Village Food Bank to exist and therefore have sort of donated or whatnot. The our main issue really is about donations of physical items. People we get quite reasonable like money, like cash money donated to us, but which actually in a way is more helpful because then I know what we need and I go and bulk buy things that are on sale or but are in date, that kind of stuff, so I can kind of more strategically use that money than if we were getting physical donations, but that is a bit tricky. And in terms of corporate sponsorship, we've been given sort of one or two donations from like Lush and Superdrug, and like some like a bakery and that kind of thing. But largely, we kind of have to self uh, accumulate all of the things that we offer. Um,
Thank you, Ruben.
yeah,
I'm going to use this opportunity to get one of my team members. For those of you that are in Brighton, we are doing a big tin collection this Christmas, which is going to be who can collect the most tins across our companies and workplaces and things around the city, which will go out to the network. I'll get them to pop in the chat because I know quite a few of you are from Brighton. So please join in with this or find out where one of the collection points is. Before I hand over to Amanda, I guess the other thing I'm going to say is one of the things, all of the projects pretty much in our network have benefited somehow from Household Support Fund over the last few years. And as we move to the new Crisis and Resilience Fund, we haven't yet had it determined what that's going to look like in terms of where the support goes. And so I think from the Food Partnership's point of view, we really are trying to push to make sure that in moving how that fund gets spent, because there's lots and lots of different pressures and priorities on it, is actually making sure that the work of these food projects that is achieving so much more than the food through this money is also recognised. Amanda, anything else you want to add on food and financial sustainability, or if there's any other questions coming into the chat, please pop them in.
But don't just like sound the finances. I've worked in the charity sector most of my life, and this is the first time I've worked on anything where we felt financially secure. And it's just luck, I think. Luck and good management by me, I have to say that. But coming out of the pandemic, our project had money. Our previous leader and treasurer, Alan, was a fantastic manager, financially, very, very good. And he managed to get in all the various pandemic funds and things. So we had I think we had 2.5 grand, something like that, to start with as a setup fund. And then just the model of people donating. And so I'm just very careful originally to not spend more than we had coming in on topping up. So our sources of food were Fair Share mainly, although that's gone down a bit, and then I top up with the shop. But we also get stuff from the hygiene bank. I think nobody's mentioned them yet, but toiletries from the hygiene bank, that's amazing. really good. We get the bread that you mentioned, Vic. Gary goes round with the fresh bread from the bakery, the local school, the local church, and then just sometimes we get odd donations. But financially, it is just that juggling thing of managing the income and the outgoing. And we've had household support fund, but what we're doing is trying to use that to build up the extras and the community things, as well as keeping the day to day. So I know that when household support fund goes, we can manage without that. But we're also very lucky we don't pay rent on the community room we're in. One day they will remember and ask us to pay, but for now, Southern Housing don't charge us. And yeah, we've just been very lucky in a number of ways about very low outgoings.
And
Yeah,
let's not underestimate the fact that the amount of volunteer hours that go into making that happen
oh yeah,
is
huge amounts of volunteer hours. If I paid, there's no way any of us could afford to be paid and do what we do. It just would not work. No, no. We have a turnover of about 10 grand. So yeah, that's tiny amounts of money. But yeah, that's what we do.
I'm going to give you both one chance to just have one last sort of sentence. We're down to the last sort of 3 or 4 minutes, which is just like I don't know, one hope for next year for your project. One thing you'd really like to see happen, or something you'd like to change. Just kind of maybe a positive thing to end our seminar on today. If either of you is feeling confident to go first, go for it.
Well, Emma, Joe, and I recorded like a short video that's going to end up being like a top tips about LGBT inclusion in your food service. So I'm really looking forward to Emma splicing and dicing all of that together and seeing that go out. In the interim, if anybody does want to chat about LGBT inclusion, then please feel free to get in touch. You can find us on the web. Yeah, and I'm looking forward to our Christmas session and sort of getting everyone together and seeing it as a bit of a celebration, a bit of a community vibe. So hoping everybody a lovely holiday season.
Thank you, Ruben. And for those of you that are here from the Sustainable Food Places Network, we will also share that little film out across the wider network because its tips are not Brighton specific. So to say that. Amanda, you've got 1 minute for your wrap up thoughts.
I'm looking forward to watching Ruben's video to make sure I'm not doing any microaggressions. We've got a good track record, I think, but you can always improve on your inclusivity. And I'm looking forward. I saw the chat. I'm looking forward to Southern Housing, fixing the hot water in the community room, being a better landlord to the residents we work with because they're absolutely shocking and diabolical. The leak through the roof the week before last nearly took us out. So
there we go. Isabel and Amanda, you can connect on that one. This is my opportunity to say thank you to everybody for coming. I really appreciate your time and attention. Thank you to Emma for the initial presentation, for Verity for being tech support, and for Ruben and Amanda. It's really, really wonderful to be able to spend some time listening to you. So I really appreciate all of that. That's the time is up. We will, as I say, we have recorded this. So if people were not able to come that you think might be interested in this, we will be sharing it. Thank you very much.